everybody. This is Dr. Brett Talley Daniel, MD, and I'm a neurologist and a headache doctor. And today I have a short little podcast on an interesting new subject in the fact that we have 3 new acute treatment drugs for migraine, drugs that just came out. So we'll talk about that. Move over Triptans. There are several new drugs for acute migraine treatment available now, and they are Nurtec, which is rimegepant as the generic, Ubrelvy, which is ubrogepant, and Rayvow, which is lasmiditan. These are all oral drugs, and 2 of them work by blocking CGRP metabolism, which is one of the inflammatory neurochemicals released by the migraine process. And the other drug works on serotonin, which is also part of the migraine neurochemical reaction. Now, ICER, that's the Institute of Clinical and Economic Review, has released its final evidence report and accompanying report at a glance on the clinical effectiveness and economic value of a trio of recently approved acute migraine drugs, deciding that the available evidence suggests with moderate certainty that all 3 offer a small or substantial net health benefit, and with a high certainty of at least a small net health benefit. So ICER clinical data suggests that the therapies all decrease symptoms of migraine attacks and improve function compared with placebos for those who are unable to take triptans. And ICER noted that for those who can, its indirect comparisons imply that triptans are more effective than these newly approved drugs. For patients who are unable to take triptans or who don't get adequate benefit from those more affordable options, these new migraine therapies appear to relieve migraine symptoms in 10 to 20% more patients than who respond to placebo, David Ryan, MD, Chief Medical Officer at ICER, said in a statement. Now, Nurtec, rimegepant, is administered as a fast-acting, orally disintegrating, single-dosed 75 milligram tablet in patients with episodic or chronic migraine. The study demonstrated a statistically significant reduction from baseline in monthly migraine days in individuals treated with these drugs compared with placebo. Treatment provided pain relief within 1 hour, and Nurtec had a sustained efficacy of pain relief lasting as long as 48 hours for many patients. Side effects were few and usually mild. The serious ones were a hypersensitive reaction, which is either immediate or delayed, dyspnea, which means shortness of breath, severe rash, and a common reaction was nausea. This is an unusual drug that works quickly for acute therapy, but it also has been approved for episodic and chronic migraine prevention. Wow, so you got a drug for acute and preventive drug all in one. You do have to dose it for prevention more often. Ubrelvy, which is ubrogepant. A recent December 2019 article in the New England Journal of Medicine found that 20% of patients who received 50 or 100 milligrams of this drug orally had freedom from headache pain at 2 hours. The FDA approved Ubrelvy for acute treatment of migraine. Side effects here were nausea, dry mouth, and somnolence. Ubrelvy has no effect on vasoconstriction, is okay with heart or stroke conditions, and there's an article out on that. This makes some help also for, like triptans work on 80% of patients, 20% do not respond well, and then there's an unknown group of patients who may have vasoconstrictive medical problems who cannot take triptans, and those are that triptans are contraindicated in patients with stroke, coronary artery disease, previous heart attack, out of sight hypertension. So these drugs can be taken carefully by those patients. All right, next drug is Rayvow. It's the first and only what they call a ditin. The name here is lamivudine. It's been released for acute treatment of migraine with or without aura. This drug is not indicated for the preventive treatment of migraine. Dosing here is 3 oral dose sizes exist as 50, 100 milligrams, and 200 milligrams, and only 1 dose should be taken in 24 hours. So the doctor would start low, as most of us would do, starting at 50 milligrams for the first trial, and then going up to 100 for the next dose when you treat another migraine, and then 200 to see what the best dose would help for that patient. The most common adverse reactions were dizziness, fatigue, paresthesia, and sedation. But there is an important safety information on this drug. A single dose of Rayvow may cause significant driving impairment due to increased sleepiness lasting as long as 8 hours. Therefore, because of this possible side effect, patients are advised to not perform potentially hazardous activities requiring complete mental alertness, such as driving a motor vehicle or operating machinery for at least 8 hours after each dose. Rimegepant and Urogepant both block CGRP activity, while lasmiditan is a serotonin 5-HT1F receptor agonist. Now, all migraine patients who don't respond well to triptans, and that's about 20% of patients, should discuss these new drugs with their neurologist, and hopefully one of them will help. And then please go to my website at www.drmigraine.com to read in-depth individual articles about each one of these drugs I've already got out there. But I just thought it'd be a good idea to let patients know about the new 3 acute therapy drugs for migraine. So here it is. Click subscribe down there, please, so we can stay in touch. And God bless all you patients who have migraine. I'll see you again on another talk.